Roe versus Wade is now reversed, and phase 2 of the pro-life movement in America is now in operation. Our goal is to uplift life-affirming resources available to women and families in every community. Make sure no woman stands alone in a post-Roe America.
Abortions may be regulated, but not prohibited by state law.
There is no constitutional right to an abortion in this country anymore as of today.
Hey, Pro-Life Gen, I'm Kristan Hawkins. Welcome to this new episode of the Explicitly Pro-Life podcast. I am so excited for you to join us today. And it's not just because I'm wearing leopard print here, not my usual black, but because we have a very special guest. You know, we have thousands of pro-life pregnancy help centers in the United States, maternity homes. Many of them are supported by an organization called Heartbeat International. Pregnancy help organizations, PHOs for short, ensure that women and families have the support they need to welcome a new family member or place a child with an adoptive family. So joining me today is a woman who has decades of experience working alongside pregnancy help organizations. And I think you're really going to love to hear her heart, hear her experience. And finally, hopefully, by the end of the episode, maybe tell you how, if this is something that's been put on your heart for phase 2 of our movement in the pro-life America, how to create a pregnancy help organization or community. I think she'll be able to help you get on your way and get started. So joining me today is Peggy Hartshorn. She is the chairman of the board of Heartbeat International, the largest life-affirming pregnancy help network in the world, with 3,600 affiliated pregnancy help centers, medical clinics, maternity homes, and nonprofit adoption agencies. You can get this: 86 countries with 1,900 here in the United States. You know that little myth you hear all the time that pro-lifers care about babies before they're born, but don't care about them after and don't care about their moms? Yeah, Heartbeat International's entire mission disputes that entire myth. Peggy and her husband, Mike, started their pro-life work in 1973. They began housing pregnant women in their home in 1975, opened up the first pregnancy help center in Columbus, Ohio in 1981, before I was even born. Peggy joined the leadership team of Heartbeat International in 1986, and she became their first president paid staff member in 1993, a position that she held for 23 years. She also co-founded Heartbeat's Option Line. It's a 24/7 bilingual internet-based pro-life call center. We actually partner with Option Line at standingwithyou.org. If you, when we run digital advertising campaigns in communities, we direct women to Standing With You, where they can begin an instant chat with the volunteers and staff at Heartbeat International's Option Line, or they can call the phone number and instantly get connected. Option Line is an incredible resource because they take about 250,000 calls each year. And they connect women where they are to community-based help centers. They recently celebrated a milestone of helping the 4th million person since their founding. So I am so excited to have Peggy on today, as you can see. So I'm going to get right to it. Thank you, Peggy, for joining me.
Thanks so much, Kristan. I'm so excited to be with you, and I love this topic. We need more pregnancy centers, that's for sure.
Yeah, you know, I guess, can you give us an explainer of like PHO 101? Now, I do probably need to clarify terms, because we used to call them crisis pregnancy clinics, CPCs. Then there was another name we gave. the name said the PRCs, pregnancy resource centers, but now the language is pregnancy help organizations, which is more broad, covers more, types and different facilities. So if you're getting kind of confused of what's a PHO, I used to use, you gotta get up with the lingo. It's not CPC or PRC anymore, it's PHO. That's what my staff told me. So can you give us an explainer of what these organizations are and what they can entail?
Sure, absolutely. We found that the word help, pregnancy help, really is what speaks to people. That tells how they're feeling. I need help. I'm pregnant. All right. So it's and often women, although they are in crisis, don't think of themselves as in crisis. They don't want to act as if they're in crisis. They say, I'm not in crisis. So sometimes they're turned off by that term. And pregnancy resource is a little bit vague. So pregnancy help organizations is kind of the generic term that we think is best. And within that, there are maternity housing groups. All right. And we say maternity homes, but these are residential care facilities now. Many of them taking care of women and their children even after the baby's born. So it's not just during the pregnancy. Then we have nonprofit adoption agencies, which is another category of pregnancy help organizations. And then the category that most people think of is what we call pregnancy help centers. And in that group, we have the medical clinics, which are the ones that focus on ultrasound and sometimes, and lots of times STD testing, sometimes early prenatal care, sometimes extensive prenatal care, all kinds of medical services that undergird and help a woman who needs help when she finds out she's pregnant or during the pregnancy at any point. And then also in that group are what we call pregnancy help resource centers that provide all kinds of additional resources. And sometimes this is exactly what the woman needs. She needs baby items. She needs maternity clothing. She needs parenting classes and help.
Things that Planned Parenthood doesn't even proclaim to offer. They don't even lie about offering. They don't do any of that.
Absolutely, that's true. And so again, to your point of the lie that pro-life people only care about fetuses in the womb, the unborn or the preborn babies, that's absolutely not true. Even our medical clinics, although they don't focus entirely on the resources a woman needs, they have extensive support programs as well. Classes for families. They follow babies almost always up to about 2 years of age, and sometimes even 3 years and following. So they don't let go of those relationships, whether they're a medical pregnancy help center or whether they focus primarily on resources but don't provide medical services. So the whole range is needed in a community. And an interesting point, Kristan, that I know you discuss is that when we talk about starting a pregnancy help organization, it's important to know what kinds of organizations are already available in your community, if any, and find the lay of the land, really get involved in the community that's there. And then you'll determine what is missing in our community to have a full range of services to undergird those women and families when they need help.
Yeah, I think that's great advice. And it goes into my second question, which is, I think, when I talk, and you and I talked about this recently at a conference we were at together, the number one thing that I hear from the pro-life generation, young men and women who are in college, getting ready to graduate, just graduated. And when I ask them, how do they want to continue their pro-life activism, their service to end abortion, the number one thing I hear is, I want to start a pregnancy center, or I want to start a maternity home. And so that's really why I wanted to have you on today, because you are the expert at starting these pregnancy help organizations. Can you give us some of the steps? I think step one you just gave us is first do an analysis of, go to optionline.org, type in your zip code, go to Standing With You, type in the zip code, and you will see all the resources that are currently available, because I think that's kind of the first way to start, of knowing where are the gaps in our community. What would be the next way to go about it?
Well, I think it's important, Kristan, even from the beginning, Yes, you need, if you feel God is calling you in this is really on your heart, you can do a lot of preliminary research on your own and start visiting the centers and the resources that are in your community, or if not in your community, near your community. But I think it's really important early on also to get a team together. Two heads are better than one. Not on the same person, obviously, but really get a team that's helping in this as well. Share your passion with others, and see if you can gather a group, a kind of a leadership team that shares this vision with you. It could be people in your church. It could be students that you know. It could be people already in the pro-life community there. In your town or city. Start meeting people and say, help me with this. Let's get together, because discerning the needs is really important. It's more, and it needs more wisdom usually than one person. So when we started our pregnancy help center here in Columbus, my husband and I were involved in the marriage encounter community here. We knew a lot of couples who believed they were called in their coupleness to be involved in God's work somehow. And these people had a pro-life burden. We also worked with people who were already in the pro-life community at that time in Columbus Right to Life. We worked with people in churches and parishes. That group then said, okay, to their friends in their churches and parishes, we're getting together and we're trying to discern if we need more pregnancy help in the city, and which was very clear that we did. So that's important, I think, also not to think this burden is totally on me. God will use his people and people with many gifts. So one of the things that Heartbeat suggests is that you put together a team. And we actually have a manual, Kristan, that we would be happy to share with anybody who really feels this burden. If you email support@heartbeatinternational.org, support@heartbeatinternational.org, we have a manual that we call our vision manual. It takes you from a vision of a need for a pregnancy help center through, I think, actually, we've got 15 steps before we actually get to, okay, now that you've got your center established, how do you keep it healthy? One of those important steps is, of course, not just visiting the resources that are available or in the area so that you can see different models, but also getting in touch with an organization like Heartbeat International that has a lot of experience doing this and can step along with you. One of the wonderful things that Heartbeat has developed recently is something that we call Life Launch. And you can apply for a Life Launch grant, and you fill out an application process on our website, and we choose a certain number of teams every year that are committed to start a pregnancy center in their area. And based on certain criteria, for instance, one of which is there a need in your community? And that could be because there are no pregnancy centers or few pregnancy centers, and it's an area with high abortions. Or even if it's not an area with high abortions, there is no pregnancy help there, or very little pregnancy help. And if you come into Heartbeat as a Life Launch Center, we provide a whole package of training. We even have a matching grant worth about $10,000. And we stick with you for a period of 1 to 2 years as you work out that vision in your community and actually have a grand opening. In fact, it's really exciting. In the last few years, Life Launch is not, as a formal program, is relatively new, but we have seen 34 centers started in areas of great need. And those centers are now serving a population of 2 million people that had no services of a pregnancy center near them. So it's now, when my husband and I started our center, which we opened on January 22nd, 1981, Heartbeat at that point was called Alternatives to Abortion International. They didn't have that full range of support. But one of the things they told us during the training, which was really great, was if God is calling you, God is calling you, just go out and do it. You take the first step And if God is really calling you, he'll open that door for the second step and the third step and the fourth step. But there are lots of things needed. You don't just go to the IRS and file for a 501c3. That's a step, but that's about step number 15. You really do need a lot of discernment along the way. And then when you start, you will start out healthy. That's important.
I think that's a really great advice. I love to hear about Life Launch and what you're doing, because it seems like the model that Heartbeat follows is very similar to what we do at Students for Life. Of, we want to help you start a student group on a campus, and we'll stay with you and mentor you, while that's happening throughout. But there is so much wisdom in, and it's hard for somebody like me who says, I'm going to do this and want to take action. I want to take action tomorrow, to sit back and say, wait a minute, you have to go through a discernment process. But there's so much wisdom in that, because you may not know. You may say, hey, there's no pregnancy medical center here in my community. I want to start one. But have you spoken to the local pregnancy help organization, the resource organization that maybe tried to go medical a couple years ago, but was not able to because they found some administrative roadblock in the city? So having those conversations will help you, I think, discern and kind of save you a lot of frustration later, if you do it at the beginning. And I think that's important.
The other thing, Kristan, and I know I see Students for Life, you're such a healthy organization. You have so many people around you as a primary leader who have just as great a passion for your mission. And when you start with this vision, with a team around you, they catch the fire, and they're part of the, in a sense, ownership of the vision. And so they will keep running with you. In the end, when you actually get the center opened, those people may not be staff members. Maybe a couple of them become board members. A couple of them become some of your greatest donors. Some of them may stay in the community, but work with, maybe one's a pastor or priest. That person will really be motivating the churches to get behind you. So as you do it with a team, that whole team catches fire. And then when you start, you're not a lone ranger.
That's right. I mean, I think that's important, because I hear that question a lot of, the young people that I have the honor to mentor of, how do I avoid pro-life burnout? And first of all, I have to admit, I hate that term, Peggy. I think you have high performance times and low performance times. It can depend on what's going on in your family and your health. But I hate the word burnout, because I think it's just such I don't know, it triggers me. To use another triggering word, it triggers me because I think it's just like this fallout excuse. But we do hear that a lot of, well, how do I avoid burnout? You avoid burnout when you recruit others to join you in your mission, and they're owning the mission just as much as you are.
Absolutely. And that also shows your humility as a servant leader. One of the things that Heartbeat talks about a lot is servant leadership. A servant leader is serving others, and primarily, though, serving the Lord. So when you surround yourself with other servant leaders, they are serving each other. And so your team is bolstering you when you need that extra encouragement or you need that extra prayer support, and you're doing the same for them. That makes you not a lone ranger, I can do it all, but a servant leader, servant to the Lord. And Jesus didn't do it all by himself. Look, he surrounded himself with the 12. And then he commissioned them and passed on the vision to his core team. So let's use Jesus as our example of the great servant leader. He could have done it all on his own, right?
That's exactly right. I love talking to you, because I'm just like, oh gosh, I just would have had Peggy's wisdom 16 years ago when we launched Students for Life. I could have avoided so many mistakes I've made. I love it. I think this is so helpful because I do hear this all the time. This God's placed this on my heart. But you also are also being called not just to lead and save lives, but you're called to be a servant leader. And what does that really look like in your communities? There's a lot of numbers and stats. And I actually want to end by kind of going over some of the numbers and stats about how much and that PHOs really do across our country to kind of dispel what we hear, in the mainstream media. But Can you tell me, I think I'm a numbers person, so I'll just admit that everyone knows that when you have a conversation with me. You don't hear me always talking about the stories, but can you share with us a couple of client stories over your 23 years at Heartbeat, what you did, with you and Mike starting your own pregnancy help organization, some folks that, how they were impacted by what you did, by starting that pregnancy center, by starting the pregnancy help organizations?
Well, let me tell you, we were just at the fundraising banquet last night for the pregnancy center that we started. And we started with our friends. I, for a long time, avoided the name founder because it was our friends, it was our team, it was a whole group that really did this. But anyway, the person who was our MC, his name is David, and what an amazing story he told as our MC. He and his wife started as clients back in the 80s. And of course, I didn't remember them right away when he came back into helping us at PDHC. But he said, you were the one. I was passing out the baby items and talking to clients when he and his wife came in as college students. And they both of them had been raised in a very poor neighborhoods. They were kind of, as we might say, said back in those days, on the wrong side of the tracks. They had almost no resources. They were pregnant. They were really distressed. And we encouraged them to have their baby. And David reminds me occasionally, I'm the one that when they came and said, we're our baby, we had been working with them throughout the pregnancy, and we were working to get them a baby bed. And until we got that baby bed, their baby was sleeping in a drawer, not in the dresser, but that was typical in those days until you got your baby bed. So we worked with them as clients, and it's amazing now. David, they got married. They have 4 beautiful children. Their children have been successful in college graduates. David became the abstinence or sexual integrity instructor who developed a whole team. Thousands and thousands of students are taught in our public schools in this county because of David and the program that he developed under our pregnancy center. He's moved from that to a full-time position with the Family Policy Council in our state, Citizens for Christian Virtue. He's a tremendous leader. And now he's just joined the board of our pregnancy center, and his wife works full-time in pregnancy ministry. So what a legacy. I just heard the story again last night as he was the MC of our banquet. And, we don't really know often what happens after we have helped a couple or a woman on her own or a father through that crisis initially of the pregnancy. But when you see the history of some of these stories in pregnancy centers, the legacy is unbelievable. Last night, we also saw a video of one of the abortion pill reversal clients from that pregnancy center. We don't know the rest of her story. She couldn't be there in person because her baby is due any minute. But she found abortion pill reversal, which of course now is also under the umbrella of Heartbeat International.
Where does everyone go to get more information about abortion pill reversal?
Abortionpillreversal.com. Abortionpillreversal.com. That's also a client site, and you can find out more about Heartbeat's leadership of that at heartbeatinternational.org. We need more medical providers all over the country, particularly in New York, where there's only one licensed medical provider who's willing to provide the abortion pill reversal. So if you are a person who can give prescriptions, if you are a nurse practitioner, physician who would like to be part of this, we've 3,000 moms already have had a second chance to save their babies after they took that first abortion pill, and they've taken that opportunity. And we have 3,000 babies and counting. Almost 1,000, actually over 1,000 moms chose that last year. That's under great attack. Our ads are being censored by Google. So pray for that, and pray for the heroic moms and the physicians that are willing to do this. Yeah. So sometimes we hear a story from a pregnancy center where the story, in a sense, is just beginning. The mom has just saved her baby, who we don't know what's going to happen to that baby and mom. And then sometimes we hear the story 30 years later There was also a woman who came up to me and my husband after the banquet last night, and she was with the son that she placed for adoption 35 years ago. And they have finally gotten back together again. And she said, I've sat here at these banquets every year and hoped and prayed that someday I could be also reunited with the son that I gave life to and made an adoption plan for. And they were there at our banquet last night. So that's one night, one banquet, one pregnancy center. And we're multiplying that by 3,000 locations all over the country right now. So it's just a phenomenal story. And we want more people to be part of it.
That's incredible. I mean, if that doesn't give you goosebumps, I don't know what will, because I think it's so, I hear, similar stories of Students for Life. I remember one time I was sitting down with a potential investor of Students for Life, and they were like, well, how many babies did you save this week? And I'm like, I don't know. I can tell you how many active groups were on campuses, engaging in discussions, trying to change policies on their campuses. But a lot of times we don't know. We have the conversation. I can say, we had 150 conversations today on the campus. We changed 15% of minds that we talked to. And some of those minds are young women who are going to find out in a couple of days or months that they're pregnant, or a young man whose girlfriend's going to come to him and say, I'm pregnant. And we hear these stories that are just incredible of, I came up to your table, I grabbed a fetal model, and then 6 months later they go back to the Students for Life group and say, I didn't have an abortion because I saw that fetal model. I still have that fetal model you gave me. And then when I was at Planned Parenthood, I was reminded of that. And so you just never know. And so it's doing the work God calls you to do.
One of the things that we love to talk about is planting the seed, perhaps water that seed, to pull out some of the weeds, to nourish that seed along the way. God is using so many people and so many of his servants to work in this vineyard and to save lives and to make sure we have healthy babies and healthy families. And so whatever your part is, don't think you're the only one. Someone said to me one time early on, Kristan, you had that same passion that I do. I guess I was coming across as so passionate. They said, you know what? You don't really have to save the world on your own. Jesus already did that. But he also has called so many people into this work. So having the brochure, seeing a fetal model, talking to someone who works in a pregnancy center about the help and support, hearing a story that can inspire you as well to make a life choice. It's happening all over. So we don't have to feel alone.
That's awesome. I love that. I was gonna use the planting a seed analogy. You took it right out of my mouth. So that's exactly right. We're on the same page, and he can use all of us and all of our giftings and our experiences, and hopefully to get you involved, to step up, to do even more now in a post-Roe America. It's so inspiring to hear these stories, but then I look at even the statistics of, more than 828,000 babies, the Charlotte Lozier Institute estimates, have been saved by the work of pregnancy care centers, pregnancy help organizations. 76% of women who seek abortion say they would choose life if circumstances were different, which pregnancy help organizations can do. There are nearly 3,000 pregnancy centers across the United States who serve 2 million patients a year, and those facilities outnumber Planned Parenthood facilities by more than 2,000. It's unbelievable when you look at this massive army that's out there that's serving in love, that doesn't have $600 million coming in from U.S. taxpayers and this huge PR army and PAC and 501c4 organizations. But it's so amazing to see all this incredible work happening across our communities. Peggy, I want to give you, the last few words, especially for folks who maybe have heard these stories now and have said, that's it, I have to step up, I have to do something. I want to see these legacies left in my community, of these lives change and transform. Can you just give us real quick again where to get the information about your launch program, your Heartbeat International's training manual? And we know the first step is really assessment, discernment, getting that team around you. And if you have any other nuggets of wisdom you want to share with folks as they kind of start exploring this road.
I guess one thing that I think may happen as people step forward and take that first step or that second step is they may all of a sudden, even though they're very confident at first, begin to feel overwhelmed about the obstacles, about maybe people have tried it in the past and they haven't been able to start the center. You may get discouraged. Maybe very few people respond to being part of the team. But I love the reminder that if God calls, he also equips. God doesn't call the equipped, he equips the called. And so if God is really calling you, he will equip you. It's a God-sized task. If it weren't a God-sized task, you wouldn't need God to do it, right? It is a God-sized task. So he will equip you. That's the important thing. But remember, you are part of his army that he's already been growing and developing in this country for over the last 50 years. So don't try to do it on your own. And Heartbeat is here to step up with you, to be a support in any way that's needed. So all you need to do is email support@heartbeatinternational.org, say what you need, and they will refer you to the specific department at Heartbeat that can help you the most. We have our vision manual, a vision for your organization that could help you as a first step. You could find out how to apply for Life Launch. We can pray for you if you have specific needs because you're already starting a center. Maybe you need more fundraising training. All of that is available at Heartbeat International. So we are here to step along with you. And God's empowering all of us. You know, I mean, we don't know all the answers at Heartbeat International either. We need the great people on the ground that are really working hard and developing new programs and sharing everything they've learned about best practices at our Heartbeat conferences. So you will be part of God's team that he's been forming for a long time. And we welcome you in any help that you need. abortionpillreversal.com to find out about that. If you are looking specifically already for other kinds of support, specific manuals, specific training, our website for those service providers already is heartbeatservices.org, heartbeatservices.org. And then Optionline, as you mentioned, wow, what a great resource, optionline.org, to find all the centers around you and get started.
That's amazing. Thank you so much, Peggy, for coming on to the podcast today and sharing all these nuggets of wisdom. This has been a really fun episode for me just to hear how much support and resources are out there for the pro-life now post-Roe generation as we take these next steps in a post-Roe America. How do we ensure no woman stands alone? And so great to have amazing partners like you all at Heartbeat International with what we do at Students for Life and standingwithyou.org. So thank you so much for coming on. And thank you all for tuning in today. I hope this conversation was informative and inspiring for you, and spread it around. Share it with other members in your community and other members in your group who maybe you've already started having this conversation of what more can we do. Maybe this is your calling.